Good afternoon. Okay, I'm going to try one more time. You guys, good afternoon. We have about, it's not working. They're going to get it behind us. Thank you. Is it working? Oh, there we go. Oh, not yet. All right. So it is true that all the useful things in our life we learn from our toddlers. And that's what they do in preschool, and apparently it works for all ages. So I hope you guys had really fruitful, productive small group sessions. And I'm really looking forward to the wisdom that was shared amongst your small group and how we can lift up that wisdom to bring it to all of us. So in order to do that, I'm going to introduce you to the moderator for our next session. And so I would like to introduce Osula Rushing, who is just the most lovely person. So Osula, it's true. So Osula is the Vice President for Programs and Strategy at Grantmakers in Health. She is managing program development, strategic positioning, as well as supervising program staff and cultivating external relationships and new ventures. Rushing first came to Grantmakers in Health in 2004 as a senior program associate, and in 2007, she was promoted to program director. Previously, she worked on issues related to access and coverage, health reform, and social determinants of health. She was also a policy analyst for the Henry J. Kaiser Foundation, where her focus areas included race, ethnicity, and healthcare. She got her undergraduate degree from Spelman, and then she got a master's at the Harvard School of Public Health. And it's my great pleasure to introduce Osula, and she will introduce the next panel. Thank you, guys.
You know, both Jason and Joan opened their remarks by saying how good it was to be in a room of smart and thoughtful friends at a time of such uncertainty. And I feel the same way. The positive vibes in this place are palpable, and that is exciting for many of us who have been in tougher rooms over the last week. We have had a day full of provocative presentations and informative, inspiring conversations that were concrete and creative at the same time. And we are not going to try to sum that all up here. What we think is particularly important in this moment is to think about the implications for funders and moving forward. And so that's what we've been asked to do. And so you have met my panelists if you were here this morning. I'm going to ask them to come up now in the order in which I name them and to sit here. We've got Debbie Chang from Nemours Children's Health System. Debbie, if you could sit here. Very good. Suzanne Minnick from Mid-Iowa Health Foundation. Ann Mosley from the Aspen Institute in Ascend, Susan Pepin from Virginia G. Piper Charitable Trust, and Ann Siegel from Child Trends. And what they've asked me to ask them to do, you see how I'm trying to make it not my fault, is to take, is to take 5 minutes, okay, each, to reflect on what I'm going to call one question, although it's written here as 4. And the one question is, what did you hear in your sessions about what funders can do? How can they use their influence, their leadership, their dollars, and their voice? What are the biggest opportunities and challenges to consider, and where do we go from here? 5 minutes, okay, each. And it's a tough charge, so I want to give you a North Star. Earlier this morning, Fran Gary, is Fran here still? She had to leave. Okay, Fran, I hope you all heard it. If you didn't, it was astonishing. Fran said, we all just need to get a little crazy for these kids, all right? I loved that. So we're gonna try to use that as our North Star today in our remarks. Let's all get a little crazy for these kids, Okay? I'm going to turn first to Debbie.
Well, we had a great group, and I think in terms of getting crazy, one thing that we talked about in our group is there are a lot of options under current Medicaid law to go upstream and address the social determinants. And we talked about the fact that, because Medicaid traditionally is viewed as a medical program, clinical services, clinical providers, states don't often think about those opportunities. But for the last couple of years, particularly after the implementation stage of Obamacare, states have really started focusing on going upstream. I'm looking at Peg here. Oregon's a good example. New York earlier was a great example. Washington State. There have been a lot of states that are doing really innovative things that can really help children in the ways that many of us in this room have been, wishing for. So I think that's, there's a lot of opportunities, what we talked about. We did talk about the fact that, Medicaid's very complicated. And so that is what often is presented as a barrier, right, to doing things. But with a little persistence, that there are these opportunities. And in fact, the other thing I observed is we had 4 organizations that presented. It was Nemours, and it was the Green and Healthy Homes Initiative, Trust for America's Health, and the National Health Law Program. And those 4 organizations are doing a lot of work across the states to try to simplify these Medicaid rules, get out the information to people so that people like you and your states can pursue some of these options. And so it made me think about that's certainly a role of funders at the national level, but also you have comparable organizations at the local level that could also do this type of work, this kind of integrating work, convening work, backbone organization work, thinking of collective impact, so that's another place I think that funders could focus on locally as well as nationally. Let's see. The other 2 things I wanted to mention is that, particularly when you're thinking about Medicaid and when you're thinking about multiple sectors, it's really important to think about partnership at the very beginning and to really engage your Medicaid partners, very early in the process and throughout. And one of our speakers talked about the fact that, that they had formed a coalition of public health and housing. And it reminded me of, 2009, many years ago, Nemours also formed a coalition of early care and education and obesity prevention. So forming these coalitions, I think that's another thing that funders can help to stimulate. And all of these things are funders as catalysts. Mm-hmm. I do think it's important when you think about funders as catalysts to think about the sustainability issue, though, and that's why we're all thinking about Medicaid, right? Because it can be a sustainable funding source for some of these activities. So with that, I'll stop.
Nailed it in 5 minutes. Gosh, I got to restart my timer. That was fantastic. Thank you, Debbie. All right.
Well, I don't know about all of you, but I feel like I could say ditto, right? So at the risk of being redundant or maybe to drive home points, I'll still echo some of them. I'm going to lead with Pradeep had a wonderful quote as we were walking out of the room that I told him I was going to steal. And he said, we are on the leading edge. It's not about what we can teach right now, it's what we can learn together. And I feel like today has been such a profound example of that. So thank you to everyone for organizing today. I feel buoyed up, perhaps, is a good way to describe it. So I would say we also had 4 to 5 themes come through in our dialogue. And persistence, I loved Get Crazy About Kids. And I think as funders, we do have to keep showing up as advocates. And now more than ever, we have to keep showing up. And so to take on that role as catalyst and convener and keep bringing in those unlikely partners and the likely partners who are tired. And how do we buoy each other up, I think is a critical role we can all collectively play together and need to. And in that coming together to really identify those shared metrics. what is that common gap that we all can agree upon? Maybe we're coming at it from different lenses or angles or even responses, but can we come up with those shared metrics? And that kind of helps you have that centering piece when you come together, and hopefully then also identifies impact down the road. At least that's our goal. I would also echo the theme we heard a lot was to have all of these partners, especially Medicaid, at the table from the beginning. We have to remember that their job, their mission is to help our kids. And so utilize them as a thought leader right along with us, and having that wealth of data and expertise, and come at it from a partnership perspective, which I know I'm not always, I sometimes am guilty of not doing that. Another role for funders was kind of that idea of funding to get everyone on the same page. So that metrics, but it takes a long time to make that a reality, that everyone sitting around a table is looking at each other with a common agenda and a common vision. And so as funders, we have the capacity to help fund that time and space to build trust and relationships. So much of what we do comes down to trust and relationships, and our funding can go a long way in helping to secure that. Right, kind of to pivot off of that, is demonstration projects accompanied by advocacy efforts. So demonstration projects, that innovation, being on the front end, but if we aren't accompanying that right from the beginning with advocacy efforts, then we tend to do a lot of demonstration projects, and they don't go into sustainability mode or scaling mode. And then finally, the investing in that connecting to resources. So it's the literal connection to resources, but back to then the building relationships and trust, that those are our most valuable resources. And as a community and funders, we have the wonderful responsibility and honor to be able to be that third party of bringing people together around a table. So did I get it in under 5?
Splendid. Oh my gosh, 4 minutes. But it's not a race. It's not a race. It's not a race.
I just don't want to be like 10 minutes
While the stakes go up. Well, we had a great conversation, and we had the benefit of the deep expertise of Donna Cohen-Ross, and specifically really thinking about Medicaid and screenings and going from what's kind of policy at a guidance level, but then what does it mean to go all the way down to the community health and to the actual experience. And then we also had a wonderful chance to hear from the innovation that's happening in Montefiore in the Bronx, and really thinking about how institutions and how health platforms can really change their practice, their policy, their culture. And then we had the nurse-family partnership talking about a very strategic intervention that's highly intentional, thinking about connecting in with first-time mothers. So we had a wonderful kind of conversation to go into some specific details, and I think we danced between specific opportunities, saying, let's really look at how Medicaid, how the screening specifically, how do we really take that all the way through so that we are really thinking about how we're changing the child and well-being visit, child and mother, and what does that mean for doctors and community health. And so that was a fantastic conversation, thinking about different ways that could also leverage that around place to policy. When we talked about the nurse-family partnership, I think there was some, obviously the nurse-family partnership is doing very strategic work. They're a real lead in the evidence-building space. But how do we talk about the challenges of scale? And so Jenna and others in the room brought up a very important point, thinking about, let's be precise, where do we use philanthropy dollars and where do we use public sector dollars? And then we kind of riffed out, while we were focused on Medicaid, how do we look at the Medicaid funding, but there's also other sources of funding that can be blended and brought to the table. And so specifically looking at some of the work that's been growing around the area of women's health, that has a shared North Star, just like on the screening on maternal health. There's new opportunities. So just thinking about that piece, both other pockets like that, And then also really tapping into innovation that's happening in human services. And sort of at the human services level, we talked a little bit, and I'm sort of riffing here, but thinking about the innovation that's happening at states across the country, and also at the county and community level. The last thing that I would sort of say from this, that one was, let's get crazy about kids. We were tasked to really look at the 2-generation approach. And we were really looking at infant and toddlers. So the 2-generation approach ultimately says you care about children and their parents together. So the challenge out to the funders is, let's get crazy about parents. And I think when we think about parents, there's a lot of deep-seated issues that we haven't had a robust enough conversation. And so Yoli brought this up, and one thing to wrap up with, we talked about, we just completed at Aspen a series of focus groups of young parents across race and ethnicity, mothers and fathers, 24 and younger, and then parents of children 4 and younger. So we're getting to that sweet spot of the young ones. And just listening to them on what they say about what information they know about, how do they feel respected in the process? There's a whole new opportunity. I think there's a whole new paradigm around parenting. And so we talked about how we might partner up with the campaign on some of that work. The last thing that I would just put out there for funders is, you think about this work. This is a health group a lot, and some place-based folks, when I think about some of the folks from Florida and Sarasota. I was just the other day with a whole group of early childhood funders. So who are the early childhood funders? Who are the other ones around the adult services? There's a brewing up conversation. And so how do we bring that to the table? And then the last thing I would just say, self-reflection to our group. As we talked about infants and toddlers, we talked a lot about maternal health and parents. We never said the word fathers. And I got to call us out. So I hope my group still keeps me.
Thank you. Fantastic. Susan?
I just wanted to thank Raina for starting us out with a poem this morning, one that I love, by Robert Frost, and to add to, not to be too redundant, but as a funder and a physician and someone who's worked in public health, it is wonderful to be in this room and to have had these conversations in this uncertain time. So I'm leaving much brighter, hopefully in many ways, than I was yesterday. So thank you all for that. We had a wonderful conversation, really honed in, though, just to vision health. And we had 3 examples of some innovative things and thinking going on to comprehensively try to tackle in geographic areas, or in states, how to not just screen, which for vision it seems obvious, and the data's there for how important it is for success, not just academically, but socially, and why it falls off the table so often and doesn't get included, and it's hard to do, to measure in terms of screening. So we also had a national leader in a group under Prevent Blindness that really focuses on children's vision health. So we had really good perspectives. And happily, the work being done in different ways, really 4 themes emerged, and they do, you've heard them. The first is the opportunity, and for all of the things, there were great examples on how to leverage Medicaid and what that might mean in terms of thinking more broadly on that, not just policy, but Medicaid. So the first being funders to convene and be a catalyst. We must creatively engage the various diverse partners that really need to be at the table to overcome barriers. Otherwise, we're not going to get there. And the barriers, those themes and examples were so consistent between these different groups. The second is to raise awareness, our responsibility as funders, or our potential to really do the critical education, not just for families in terms of the need for vision health and the importance and what that can mean to the family, but also to providers of all different levels, that it's not just about one segment of raising the awareness. And then also we have that responsibility to raise it to the national conversation. So whatever that advocacy is on that level. The third theme was, and this sort of goes along with going crazy for these kids, is we must, as funders, try to create access, particularly in these fields we're talking about, any way we can in our local areas, whether that's through Medicaid reimbursement ideas being one of them, but we must advocate. And the fourth and final one was a powerful theme of data. Not just is it challenging to figure out our environmental landscape, what are the needs, what are the gaps, but then how do we collect data, what are the privacy issues, how do we follow children? What is the system where it's not just a screening that's done and then we don't know who got looked at when they failed the screening, or it was a positive screening and hence they needed to be looked at? Did they get follow-up? What were the outcomes? And then it's not just we're going to screen once. It has to be a multiple time, and kids move around, and how, do we tack it on to immunization following? What do we do with the data? But it's a powerful, needed, obvious need to understand the landscape for follow-up. Are we making impact? And as funders, we have an opportunity to support that, and we can often pull in the resources to do some of that digging where it may not be that your Health and Human Services or wherever you're trying to find it, the schools don't have a nurse except a half day a week. So that's a big responsibility, and that theme was incredibly strong. And I can say this because most of my panelists already left for the airport, that would be the number one need in terms of vision health for children in having a system. So those were our 4 themes, and I'll leave it at that because I've probably gone over time.
You did. That's good stuff. Thank you. Anne.
Okay, yes. Well, we tackled oral health, and it's kind of a good thing to be sitting at the end because I think it's the new kid to the block in terms of health care, and clearly spurred by the death of a child in Montgomery County here, Montgomery County, Prince George's County. So I think we're coming into this at the time where you watch foundations build. And one of the things is they've done analysis. There's been a lot of that's gone on. That's the data and the input, which is a good foundation role usually. Innovation, which we heard a lot about, and I'll go through that very quickly in a minute. Testing that innovation, coming out with advocacy to support those things that work, and admitting those things that don't, I would say, as a foundation. It's very important. We've had a lot of community change efforts over the years, and we know some things about what works and what doesn't, and across fields, and we ought to be sharing that with different disciplines rather than just going at it through health or through early childhood or through whatever other set of providers we're doing. And then basically pushing for changes in funding strategies, but also sharing the results of these things and sharing what's out there. I think there was a point made this morning by one of our physicians on the panel of, we should be sharing things a whole lot more, that we have these demonstrations and nobody knows about them in some other part of the country. So that was kind of where I was. Now the central theme that came out of this discussion this afternoon was that we need a major systems change around dental health in this country, and oral health, that goes to where the kids are rather than making the kids come to the dentist office and not necessarily even needing a dentist. So 2 of the people on the panel quoted the same quote. I'll give you another one from the morning to take home this afternoon. Wayne Gretzky's quote of, "I skate to where the puck is going, not to where it has been." And that's, I think, sums up very well what we need to do in oral health. So we had a wonderful panel. Paul Glassman talked a lot about the power of virtual dentistry and teledentistry. And that doesn't mean the dentist is out of it. It means that you're augmenting him, and he doesn't always have to be in the place, that things are done. And that a lot of these children, which I found fascinating for my own self, can have their teeth not drilled all the way down, but have them sealed off, and that's just as effective to stop the decay. So, and we're certainly drilling. I can tell you that from my dentist. I'm going back to him after this. And then Jeremy Crandall from Pew talked about the dental therapists, which are now in 6 states and 55 countries, I gather. And it's very much like the movement of a nurse practitioner in the country. And it's clearly going to be the dentists who are going to be most in the way for a while, I think, on this. And then Brian Sousa, who is from the DentaQuest Foundation, who's funded a lot of these things, really brought home the need to change public opinion on what is needed for oral health. It's like, I liken it to the obesity movement, where it's an individual health decision and people blame them for not brushing their teeth and not taking care of themselves, instead of seeing this as part of a whole health package. And that we need to bring health and dental health together, that they really belong much more together than they are now. And that he had a whole list of things, and I'm sure they're on the website of his organization, but it was fascinating. And then Meg Booth brought back up to the high level again this need to start really early with kids, that we've got to start at the very beginning and with the parents as well as with the kids. And I would agree with Ann, it's both father and mother, although we keep saying mother, that we will bring the kids into dental care much faster if we have the parents already there. Then she moved us to going into the school so that it keeps going. You can't drop off at any point along the line here. And that action is what we really should be focused on. And I've been in several meetings this week, and this has been a good one in terms of you see good things going on and excitement and wonderful ideas, which I've learned a lot today. But they all end up, every meeting I've been with, because they've been advocates like everybody in this room, they all say, let's get going. It's not stop now. It's getting crazy about the kids, but let's do it now. Let's start moving, don't wait. And I think we heard that at lunch, that we don't have any time to wait because things are going to move too fast on us. So that's where I end up.
Fantastic. Thank you very much. All right, let me tell you what's going to happen next. What's going to happen next is that I'm going to turn to all of you, and I'm going to ask this question. Is there anything that came up in your sessions that wasn't addressed here? And then there's going to be an awkward silence, and nobody's going to say anything, because that always happens when you kick it out in the beginning to the audience questions. But I am going to sit here peacefully and wait for someone to say something, because I have been assured by Ralph that there is a door prize for the person who speaks first, and it's a good one. So, is there anything that came up in your sessions that wasn't addressed here?
Yes.
Ralph, get the prize.
Well, it's backbone support. The question of backbone support. So if we're going to do any of this work, particularly in the area of oral health, where some of the time to build the capacity to deliver the service is all front-end stuff. So it's backbone support, and it's the unreimbursed health education, health literacy that makes it fit and work for parents.
Fantastic, thank you. You have all now been emboldened, and so the second person is ready to compete for the second prize.
So I know I already talked, so it's not fair, but I was sitting up here and I thought to I wish I would have said this. I also think we have the mandate to continue to listen to those we ultimately strive to serve, and to harness that voice, empower that voice, keep listening to that voice, because we can get in our own, especially as funders, what we're going to do too. And so I didn't say that, and I wish I would have said that. And I think that's been a theme that's been around today, but I think it deserves stating one more time.
Absolutely, agreed. You don't believe there's a second prize. That's the issue? You believed in the Mercedes, but you don't believe in the Jaguar?
Just that as funders, I think we have to be organized and focused and efficient and effective, or we will lose credibility. Because if we throw that's why today has been so helpful for me. If we throw too much at the problem or too many different ideas, and we look like we're scattered, we aren't listening to each other, we have no chance of sustainability or catching the ear of the right audiences to move these things forward permanently and in a real long-term, long-range way. So I think that's a responsibility we have as funders, to do things just like this, but really keep it up and not reinvent the wheel and learn and collaborate.
Thank you.
Can I say one thing as a non-funder?
Yes.
So as a former funder, I think two thoughts. I think is when we've talked to, like, when you're doing two-generation work, you're clearly working across populations and you're working across systems. And so in the world of funding world, we all, many times people say, let's fund and get to efficiency first. And so sort of like in a little truth telling, I think, what would it look like for the funding community to say, we're going to fund a little bit more to bring the early childhood health system together with the early childhood system, the health system and players, and the school system, So you're getting infant and toddler, you're getting up to 5, you're going into the school system. What would that look like to give you extra money to do that versus, hey, all come together and we're going to give you less? So I think that's something on the collaboration paradox that would be interesting. And the other thing I would just, so like if they're not saying that to you, they're definitely saying that about you. The other thing I would just say on twofold, I think the messaging piece, because there's a lot of different messaging framework from where you sit. And I was just sort of thinking about even lining up, listening to the different sort of polls and tools that are out there. Maybe there's a chance to bring that together and think about some common messaging, or how to get that out to your grantees or your partners. And then the last thing is, and this is sort of like the real deal stuff, is, this has been a great day. I was at the White House this morning and people were rolling, and I'm just like so happy for the first time in a while. And this has been fantastic conversation. But people are really trying to figure out how to adjust. So as you're rolling as grant makers, like, hello, someone has money, someone needs money. Try to get rid of as much as you can, the power dynamic, and have the most sort of honest and open conversations, because people are concerned, they're scared on many levels. I went a little down at lunch when I thought about the future of Medicaid and Medicare. But you are very powerful, and you can be a huge force for good for the conversations, who you bring people in. So as we think about data, which is hugely important, also think about what are going to be the values that guide you through the next week and through the next couple of days, and how do you bring in your grantee partners into that?
Well said, Anne.
Yeah, I'd also go back to sharing in general, not just the messaging, but everything that we know that's best. I think the more that we can share things that have been tested and proven, and we know what's good, and we can show people, especially if we devolve a lot of things, because we'll be down to, again, trying to persuade certain states or certain communities to do things totally differently. They're not going to come down from up above as a one kind of model. So, I think it's going to be very important for foundations to step back in that role and say they themselves have to get together to figure out a way to share among all the foundations, which tend to hold, I know I've been there, hold on to your own stuff, rather than get it out there for everybody to use.
Fantastic. You got the final word, Anne. We're getting the hook. Join me in thanking my panel.
All right, fantastic. We are almost done, you guys. I so appreciate you hanging in there, and we are going to give the opportunity for our last remarks to Dr. Bernard Dreyer. And Dr. Dreyer is the guru of my family of pediatricians. He is the president of the American Academy of Pediatrics. He's the prior president of the Academic Pediatric Association. He is the executive founder of multiple committees that are dedicated to lifting up childhood, including the Pediatric Academic Association's Task Force on Poverty. He's also on the airwaves. He has his own radio show called On Call for Kids. Hopefully he's not on call right now. And I would like to welcome him up to the stage. Thank you.
Thank you. I just want to start by saying that I feel pretty humble being up here having the last word, because of all the expertise that is sitting before me and those who already left for the airport, which unfortunately I will have to do soon as well. I also know that I'm the last thing between you and a glass of wine, but that's a good place to be, because your mood is as good as it's going to get as you're thinking about that glass of wine. I tell this story, I shouldn't waste this time, but I'll tell you the story. When you run for AP president, there were 8 candidates, and you get sent to Elk Grove Village, where the main office is, and the nominating committee interviews each candidate for an hour. There are 8 candidates. So they asked me when did I want to be interviewed, and I said I don't care. So of course I was put last. And so all day long I was thinking about it. But at the end, it turned out to be the best place, because they were in a really good mood when they saw me, because after me, they were going to have their glass of wine and dinner. So, it's like, that's probably why I was chosen. I also want to repeat what I've heard about how lovely it has been to be here. last night, to actually, for me, it was coming to the reception last night, was suddenly, I'm around friends, colleagues, people I know. We were all hugging each other. That's exactly what I needed. And I think that's exactly what they needed. So, so we should just give ourselves a collective hug here. And even the people who are angry, I'm getting a lot of angry, Karen Remley, who's the CEO, and I are getting a lot of angry emails from either members who think we're pinko liberals, or one member who thought I wasn't hard enough on Trump, and so he was going to leave the AP. So there's just a lot of anger out there, I think, and there's no anger in this room. So I'm feeling very, very loved and supported and nurtured, just like children should be. Okay, enough of that. No, but I just want to start by saying that the discussions we're having today are among the most important discussions for the future of our country and for children and families. There is nothing more important than early brain development and being ready to start school. I mean, you all know the research, but I'm just going to, when I talk about this incessantly, and one of the things I do is I show a picture of a newborn brain and a 2-year-old brain. The 2-year-old brain is about 3 times as heavy, probably 4 or 5 times as big, and it doesn't actually get that much bigger as we become adults. And I sort of say, think about what's been going on in those 2 years. And if we neglect those 2 years, how will we ever make it up? And we know from the research that those, I was just reviewing a research article that's looking at differences, not between poor and rich, but between people below the 100% federal poverty level and people just above the 100% federal poverty level, showing very significant differences in cognitive and language and social emotional development as early as 7 months or a year. It starts very early. We really need, so therefore what we're talking about today is really critical. Okay, and we know that by the time kids get to school, on the average, it's too late to begin. That doesn't mean there aren't kids who are resilient and do great. And that doesn't mean we can't rescue kids in school. But it's much harder to do it than if we do it earlier. I want to next talk a little about what the AP has been talking about. So for those of you who pay attention to the AP, we've had a number of policies over the last 4 or 5 years that have focused on this issue. As I said earlier to our small group, our 2 strategic priorities at this time for children are poverty and child health and early brain and child development. So, and of course, both of them go together, as we know from our discussions today. But we put out a policy a couple of years ago on the impact of toxic stress. We put out a policy on early literacy in primary care. We put out a policy on food insecurity just a year ago, and just this past March, our policy on poverty and child health came out. So, and all of those policies have actions, and that's the whole point of policies. And what we're asking pediatricians to do, and I'm going to look in that direction, because we're not actually asking pediatricians to do anything, we're asking the pediatric team, we're asking the pediatric practice or the clinic to do it. So we don't mean a pediatrician herself is going to have to do this, but we're asking them to screen for social determinants of health. And the new Bright Futures is coming out with a new theme, which means a lot of information and tools on social determinants of health. Mostly what we mean by the social determinants of health is helping parents meet the basic needs of their child. So if they're about to be homeless, can you help them? If they're hungry, can you help them? If there's no heat in the house, can you help them? If their utilities are going to be turned off, can you help them? If they can't get childcare, can you help them? And that means really connecting with community resources. Obviously, the pediatrician or the team in the office can't magically help them with any of those problems. They have to know what those places are in the community to help them. And so thinking about changing the healthcare system to really have within the pediatric office connections throughout the community, and we talked about it actually in our group earlier. I think that's a key thing that we really need to focus on. I also think, and we talked about this in our group, we need to connect all the legs of the stool. I joked that there are at least 3 legs, because with 2 legs you fall down. So the 3 legs I'm going to mention are home visiting, early childhood education or child care, and then the pediatric primary care. But we could probably think of some other legs to that stool. I want to call out the importance of not because I'm a pediatrician only, but because pediatric primary care is probably the one universal place where almost all kids in early childhood show up. Most of my patients actually show up, and I only take care of poor patients, mostly immigrants, but they pretty much show up for all the well-child visits. And, there's a lot of, so therefore, they're a captive audience for what we might want to do to intervene. And of course, the model program for this, the pioneering and model program, is Reach Out and Read. We've been trying to think about how to get Medicaid to pay for Reach Out and Read for a long time. I don't know if is Brian's? Yeah, there you are. Brian says he's close to it in 4 states. We'll see how close he gets. But I think thinking about leveraging what goes on in pediatric primary care to really, and then connecting it to things like home visiting or early childhood education. I think that the easy connection would be to home visiting programs, because a variety of reasons. Number one, home visiting programs really do want to connect to pediatric primary care, and we really could use them as far as our eyes and ears and therapists in the home for all the things that we see in the office. And there are some models for that already. So I think that if I were going to go to my Medicaid, one of the things I would do in New York State Medicaid would be to see if we could set up some models for being able to do that. And at a minimum, what you need is that they can write into your medical record and communicate with you, and you can use them as part of your case management system. So just think about that. Next, I think I'm taking a lot of time here, so I'm going to do 2 things. Number one, I want to express my annoyance at a lot of the things that we do, including me. I'm not pointing at anybody. In that we do, and we talked about this too, we do, and I think you mentioned it in your talk, we do a lot of pilot projects, a lot of demonstration projects, many of which are fabulous, and they never go anywhere. And so I think the challenge to us, we could do more demonstrations. There's always another pilot that we can do, especially with Medicaid. How do we figure out how to scale up these problems? Because if they remain pilots or demonstrations, then we're not solving any of the problems. And this is true. And it's not that it's hopeless, but I think if we pick 1 or 2 things, we have to advocate, across Medicaid to say, these need to be adopted in your state, or get the state advocacy to do that. If we don't make that step, I don't think we're really actually making a meaningful difference in the majority of children. And next to last, I think one of the things that I think just to mention is that there are special populations of children and families who need special attention. One would be immigrant families. So the AAP has been very much involved in the treatment of unaccompanied minors and immigrant families and children crossing the border from Central America. I was just on the border the day that the new president-elect was announced last Wednesday, and we were there before. And I think advocacy for immigrant families and for their needs is going to be even more important now than ever, although I think it was always important. There is a risk of them being separated, that children will be separated from their parents. I know there's a lot of fear among immigrant families about what's going to happen. I deal with it in my own clinic at Bellevue. So something to think about as a special population. They have special needs in general, but they even have more special needs now. Other special populations, just to mention them, are Native American children, homeless families. I'm looking at Karen Redliner. But I got involved in pediatric advocacy in the mid '80s because there was an increase in family homelessness in New York City due to a variety of issues. We really didn't see family homelessness much before then. At that point, there were 10,000 children who were homeless in about 5,000 families. There are now 24,000 children who are living in shelters in New York in about 16,000 families. And this is not just a New York problem. The good thing about New York City, to be fair, is that there's a law which says that every child has to be sheltered. They cannot be in the street. They cannot be in a car. The city has to provide for them. So that is some level of protection. But family homelessness, those kids, they're the highest risk group, but also they're not necessarily in childcare. They're not necessarily getting home visiting. Think about it. And they may not even be connected with their pediatric primary care because they're often somewhere else. So we're trying to, the AAP chapter in New York is trying to focus on that. Interestingly, the guy who's in charge of homeless services is Steve Banks, who used to be the major advocate for homeless families. He's the reason that the law protects the kids. So I think he's a good partner for us to work with, but I think especially a special needy group. Lastly, I just want to get back. I know this is a downer, but I think this is really a call to action. Just to reflect on what Joan Alker from Georgetown said at lunchtime, because she's absolutely right. Everything we've been talking about but is often based in Medicaid dollars or in Medicaid programs. And there are plans afoot to change Medicaid very, very significantly. As you heard from her, I'm not going to repeat what she said. We in the AAP are very concerned about it and beginning to try to develop an advocacy plan, but I think this has to be all hands on deck. And we have to figure out as a community, how do we work together strategically. I think the good news is that it's not going to happen right away because there's going to be a focus on the Affordable Care Act. I'm not saying that's a good thing, but it won't be on block ranking and cutting Medicaid. That's not going to be number one. That's going to be somewhat later. And it gives us an opportunity to sort of think about how do we mobilize other communities? How do we mobilize the governors who may not necessarily want this to happen because they're going to be stuck with much less money and then figure out what to do or not do. So I just want to end on a call to action because Medicaid is, well, it's not there now, but it should be. Medicaid is sort of the title of this conference, and if Medicaid gets curtailed, children will be hurt, and many of our plans will not be able to move forward. So I'm going to end on not the happiest note, but I think actually an important note and a call for action. So thank you very much.
What a day. So in his 1964 Nobel laureate speech, Dr. Martin Luther King said, "In spite of these spectacular strides in science and technology, and still unlimited ones to come, something basic is missing. It is a sort of poverty of spirit which stands in glaring contrast to our scientific and technologic abundance. We have learned to fly the air like birds and swim like fish in the sea, but we have not learned the simple art of living together." We've come a long way today as we've traveled, and we have been making plans to leverage Medicaid to impact change and the early determinants of school success. As a result of today, we will aggregate our themes, we will distribute next steps, and we're really excited to continue to journey. I'm going to pass this back over to the very sagacious Ralph, who will close us out. Thank you.